Good morning all. Here we are going to discuss about the Amoebiasis, which is caused by Entamoeba histolytica, which is an intestinal protozoal infection. So about 90% of infection is asymptomatic. Remaining 10% produce clinical symptoms. And here comes this amoebiasis flow chart. Symptomatic group. First we can divide it into intestinal and extraintestinal. So in intestinal, it is divided into two: the small percentage invasive amoebiasis, and the other one is mild discomfort. And in extra means it is apart from intestine. Then epidemiology. Here, this is the third most common parasitic death in India, China, Mexico, Africa, and South Africa like countries. And 15% prevalence, variation according to sanitation level and clinical diagnostic criteria. So this is about epidemiology, and epidemiological determinants is about agent, virulent factors, host factor, environmental factor, mode of transmission, incubation period. Let's move into the agent. So the main causative agent is Entamoeba histolytica, and the active infection is spread by the trophozoites. And here the agents are pre-cyst and cyst. Divided into the pre-cyst means it is intermediate form, and the cyst is spherical to 10 to 15 mm in diameter. And the agent is mainly, it is reservoir is human for several years and resistant to normal chlorine concentration of water. It is rapidly killed by freezing or heating to 55 degrees Celsius, and period of communicability is very long. Okay. Next, host factor. People in developing countries have poor sanitary conditions, like in India. Then, so traveling to developing countries may develop entamoeba infection, and patients with the immunocompromised condition may also have a infection very soon comparing to others. Then liver abscess due to amoebiasis are 10 times more frequent in adults than in children. So in adults they are more prone to liver abscesses. The amoebic liver abscess is 7 times more in men than women. So predominantly it is formed in the age of 18 to 50 years. Next, environmental factor, low socioeconomic, and they have the poor sanitation, sewage contamination, and also about seasonal variation. Modes of transmission is mainly by fecal-oral route through contaminated water and food, and direct hand to mouth. So agency of flies, cockroaches, sexually contact via oral rectal route also very important. Also, in rainy season, due to the contamination of water, it can be easily spread. An incubation period is about 2 to 4 weeks. The patient may develop symptoms within 2 to 4 weeks after infection. And now we move into the life cycle of Entamoeba histolytica, and here you can see the life cycle of Entamoeba histolytica. When the person is eating a cyst contaminated food or water, it just pass through the mouth and to the intestine, and from the intestine it just develop into the trophozoite, and this trophozoite will release infective cells in the formed stools, and this infective cells will just contaminate with the other food particles, or through water it again form the infective cycles. Mainly Entamoeba histolytica will erode the intestinal wall only, and via portal circulation it just move into the liver and form the hepatic or liver abscess. And then here comes the life cycle, that the stages of development is mentioned here. So here the trophozoite is the main form of infection, which is the matured cyst, and which just produce the infection. Then it is ingested with the contaminated food particles with the human. Then clinical presentation. The most common amoebic infection is asymptomatic. So the intestinal amoebiasis will start with the abdominal cramps with mild diarrhea to colitis and dysentery. Then extraintestinal is already we have seen amoebic liver abscess, rarely lungs, skin, genital and CNS. Then clinical presentation, it is asymptomatic patients, or they will be a carrier. 90% the patients are without symptoms and does not damage the lumen of the intestine. In carriers, the picture itself you can clearly understand the fecal-oral route contamination and the symptoms of the patient. Next we move into how amoebiasis is manifest. So it have very mild symptom or none at first. Gradually it moved from asymptomatic to amoebiasis and amoebic colitis, and clinical symptoms are usually vague. So it may cause diarrhea, vomiting, abdominal pain, jaundice, and anorexia, weight loss. So here comes the clinical presentation of amoebic colitis. You can see in this picture A and B the drastic ulceration of the amoebic colitis is seen in picture A and B, and the microscopic appearance is seen in the next picture. So abdominal cramps is the main symptom. Then this is a clinical presentation of fulminant colitis, severely formed with high fever, and paralytic ileus is also there. Here comes the amoeboma. In 1% of the cases, the amoeboma can seen with the severe inflammatory thickening of mucosa and submucosa wall, and in palpable mass with trophocyte is seen in rarely 1% of the cases. So it is in second picture. So this metastatic occurs in the 5 months of dysentery in 95% of cases, but pain and point tenderness over right hypochondrium and fever along with jaundice, rare pleural effusion is jaundice is rare, but pleural effusion is common. And here the parasite reaches the liver via portal transmission, and this is the image of amoebic liver abscesses. See here in right hypochondrium there is a severe damage, and this is the anchovy color sauce appearance when we infiltrate the collection of fluid from the liver abscess. Then complication of amoebic liver abscess is most dreaded complication. If the rupturing of amoebic liver abscess is most dangerous. Then metastatic lesion in other organs, pulmonary amoebiasis, that is rupture of amoebic liver abscess into the pleural space, and hepatobronchial fistula may happen, and serous pleural effusion or contagious spread from amoebic liver abscesses. So these are all the other organs in which the metastasis can happen from the liver through portal circulation. And here comes the brain, which is cerebral amoebiasis and cutaneous amoebiasis. So you can differentiate the single small lesion in cerebral hemisphere and in a superficial infection in the abdomen wall. Then here splenic amoebiasis there, and amoebiasis of the penis and amoebic pericarditis. So these are all the other metastatic lesions of amoebic liver abscess. So here come the laboratory diagnosis. 3 consecutive samples of stool should be taken, and biopsy from the ulcers can be taken. Sputum diagnosis may also helpful when there is a metastatic transmission of liver abscess to the lungs. Here comes the microscopic examination. Both the saline and iodine wet mounts are prepared, and the motile trophocytes are seen in saline mounts, and the internal structures are clearly identified in the iodine mount. Here the laboratory diagnosis is radiological examination, and radioisotope tracking of liver, USG and MCT and MRI can be taken. So this radiological examination may helpful to identify mainly the amoebic liver abscesses. And here the serological test, antibody and antigen detection. In antibody we can take ELISA, IHA and IFA, and antigen detection, that is coagulation test through ELISA. And in case of a person with a liver abscess, amoebic colitis is treated with trinidazole and metronidazole, and the person with luminal infection with the above drug, along with the above drugs, these 2 drugs can be advised, that is parmomycin and iodoquinol. And here come the percutaneous radiography guided aspiration lung abscess, liver abscess. So here the left lobe of liver have a large abscess and it is drained out. These drugs can be advised in the patient with asymptomatic cases, and this is passes. Next it comes a prevention. Prevention is the main thing. The sanitization and water supply, water filtration through sand filtration or boiling, and food hygiene, health education. Food health education mainly by food handlers and public are the very main thing which helps in transmission of amoebic, that is Epidemiological histolytica cyst. Next prevention is early diagnosis and treatment is the secondary prevention about amoebiasis. So this all about the amoebiasis.